as promised, great guest today as we sit here in advance not only of Hockey Fights Cancer Night, but just in general and a daily impact that this place has on the community. Dr. Mary Reid, the Chief of Cancer Screening, Survivorship, and Mentorship, is with us now. Hi, Mary. How are you?
I'm fine. Thank you very much. I'm glad to be here.
This is an amazing title. Tell us about how you come to a role that speaks to the screening, and the survivorship, and the mentorship.
Well, I've been at Roswell 23 years, and about 10 years ago, we got permission to develop a comprehensive cancer screening and survivorship program for our patients. So, we're sort of at the front end of hopefully finding cancer early, and then when people graduate from treatment and they still need support and ways to get back into their lives and feeling well again, we're there with a comprehensive program. And we have a lot of junior faculty, a lot of graduate students, medical students here, and so playing a role in getting them to develop their skills, do research is really part of the Roswell mission.
I'm 48 years old. Duffer's way older than me. Don't let the looks fool you. And I did my first colonoscopy this year and all of that. So what are some of the screening that people should look to do annually? Because I'm going to start taking notes, and I have to start doing my screening more often now, right, because I'm getting a little older.
Yeah. Well, and you're good for you to man up and have a colonoscopy. It's not easy, but let's start with women who are 40. They need to have annual mammograms.
Okay.
And as with most cancers, the earlier you find a cancer, the better.
Yeah.
Because then it's easier to treat and the whole recovery period is shorter, and you get exposed to less, aggressive treatment. And so it's always better to have a colonoscopy if you're 45 or older, and have those polyps taken out, and that really reduces your risk of developing cancer and succumbing to colon cancer. And there's prostate early detection. So if you're a man and you're over the age of 45, then you need to have either a PSA or have a digital rectal exam by your primary, and really that again helps to see if there's any issue. It doesn't prevent it, but it means that if you have something, then you can make some choices about how you want to treat it. And the last one that's not really new, it's been around 10 years, is lung cancer screening.
Yes.
So if you're 50 and you smoked for 20 years, you're most likely eligible.
Okay.
And it's a CT. It takes 3 minutes. There's no preparation. You don't even have to undress. You just get into the CT. And in that case, they're really focused on picking up small lesions that are not cancer, but they may indicate you could develop cancer. And that you get every year. And if there's a need for an intervention or having one in 6 months, you'll be told. And with lung cancer screening, we know, again, you get it small.
Yep.
You may have surgery, you're out in 2 days, and you live a long time.
It's all about not having to put your body through the hardship of harsher treatments. So by being able to get screened, especially for, like you said, breast cancer, colon cancer, prostate cancer, lung cancer, those are 4 that you can be taking steps to prevent. And then it just helps everybody, helps yourself, helps your family, but helps everybody in the long run.
And that early detection, again, and this is really true of, cancers across the board. When you get it early, before you have severe symptoms. So, we're all kind of bad about putting stuff off. We have a thing that
I have an
bothers us.
oil change light on my car I need to do, but I focus on my colonoscopy first, so the oil change can wait.
It's just the human oil change.
Yeah,
okay?
exactly.
Yeah.
That's good. I like that.
I love that. Lung Cancer Awareness Month is November. You've detailed just, Roswell's impact in this regard. We also have an upcoming prostate cancer screening event with the Sabres at KeyBank Center, November 25th. That's from 3 to 7 at KeyBank Center. Are you seeing more people coming out for these prostate cancer screening events? Obviously, that's the goal of our organization partnering with yours.
Yeah.
Do you see tangible increases in awareness and numbers here?
We do. Progressively, we see more people coming out to that screening event, and I think partly because it's been going on for a number of years, and because it's in a place that people, especially your fans, are familiar with.
Yep.
And it's a very simple exam. We do everything right there. You get a lot of information. If you need a follow-up, you're informed about it. But it's just the goal of this and of Cancer Night is to just not normalize cancer screening, but just to make it part of your annual routine. When you're young, you don't really think about developing diseases. And when you get past 40, I'm way past 40.
43.
Yeah. We're all 43.
That's very generous of you.
That was my number when I played. That's why he's saying that. So we're all 43.
Oh, that's so nice.
When you're a kid, your worry is like going to the dentist and having a cavity, right? And you're not. But it's the same thing now. Now let me ask you this, because part of the title is survivorship. So
Right.
what is a survivorship program, and why is it so important to Roswell to have a survivorship program?
Well, so when you get diagnosed, you actually begin to be a survivor. When you finish treatment and you ring the bell that's right over there, and you're so relieved that you don't have to come here every 3 weeks, or your surgery is over, that point of survivorship is really important, because the symptoms don't stop. Your concern every time you have a scan is huge, because you think, is it going to come back? So during that period, we developed a very good clinical program that does a lot of physical exams to see if there's anything residual from your cancer, pain, nausea, neuropathy. We screen survivors because your risk of a second cancer is very elevated over the normal population. We provide nutrition. We have a really active physical therapy program. So, to recover mobility, to get back to some of the activities that you used to do. We have a psychologist. We have a dermatologist, because those are all issues that survivors carry forward. And, some kids survive 50 and 60 years after their cancer, but some of them also have residual symptoms.
Yeah.
And
That's a lot to carry.
It's a lot to carry. It's a really long time. And, there's a little bit of, trauma coming through these doors, because what happens here saves your life, but it is traumatizing. And so this survivorship program works with your primary care doctor to manage your other stuff and to really control what may come as a result of treatment.
But there's also, like, we just saw one lady ring the bell, and she had a big smile walking out. But in 5, 10, 20 minutes, half hour, maybe a couple of days, all of a sudden you're like start to worry about the next step.
Yeah.
And I think that's the thing. Like, the emotions are so high and so low, and to have people there to be able to put a plan together is so important.
Yeah, and knowing what's going to come up, knowing how often your scans are, knowing if you start to develop symptoms, it may be related to your treatment. So talk to your doctor about it. Come back to us.
Yep.
So, we're in it for the long run.
Dr. Mary Reid is with us here at Roswell Park. And just to follow on that, you don't have to be a Roswell Park patient to be a part of the survivorship program?
Right. And we have a site here in this building, and we also have a very nice clinic out at 100 College Park in Amherst, across from Erie Community College. you don't have to be, everybody doesn't get treated for cancer at Roswell.
Right.
But everybody who gets treated for cancer needs some support when they're finished. And we really, we know that in the community, there really isn't anyone else who's offering services the way that we're doing it. We have acupuncture. We offer other things like Reiki and whatever somebody needs. And so we don't care if you came to us for cancer, but we want to make sure that you recover, and that if you happen to develop a second cancer, we pick that one up early, and that you start to feel a sense of wellness again, because that's the part you lose when you're getting treated for cancer.
So you mentioned 10 years ago was when it was approved for the program.
And so we started it out.
What do you think it's going to look like in 10 years from now?
Well, I hope it's going to be bigger. I hope we can, we're seeing more of the people in our area. There's about 40,000 cancer survivors in Erie County.
Wow.
And, because people are living.
Yeah.
I think what we hope really in the future is that we really understand the impact of treatment on people in the long term, and that those treatments, the effect of those treatments gets easier. So they don't have quite, the drugs that are used or the radiation treatment. We are constantly, as a cancer center, in our research, trying to minimize the dosing to make the impact less, because then we know that the long-term impact on the patient will be less without sacrificing killing the cancer.
Last one for me. You've spent your life learning about medicine and treatment and cancer. How is this personal to you?
Well, my husband is a stage 4 appendiceal cancer survivor. He's 10 years out.
Wow.
And around the time I was starting the survivorship program, I was going through it as a caregiver. And I realized that I forgot to have a mammogram for 3 years. But being the family is tough.
Yeah.
And, getting through cancer and getting screened is really about family. You want to be with them as long as you can, and you want to support them. And so, it's deeply personal. I learned a lot from him. I'm still learning, 10 years out, because he still has symptoms from his treatment. But I think we're going to improve the more our patients tell us what they're going through. And, we do low-dose CTs on people on our bus. And we're always getting feedback that we find cancers early, and that's what kind of makes it easy to come to work every day.
Well, that's awesome. And I think, outside of the medical advancement and everything that you've enlightened us with, I think the best thing you said to me was off the air when you said that you came from Tucson, but you like this weather here better because it's not as extreme. You had me sold at that moment.
Boy.
So as it's raining and getting cold for winter, but still, you had me sold then. So nice to meet you, and thank you for
very
stopping
much
by.
for
That's
having
awesome.
me.
Thanks
a lot.
Thank you. Dr. Mary Reid. She's the Chief
much.
of Cancer Screening, Survivorship, and Mentorship here at Roswell Park. And for everything that we've talked about today, you can go to roswellpark.org to learn more. And, of course, really want to emphasize coming up towards the end of November 25th from 3 to 7 p.m. at KeyBank Center, we've got our prostate cancer screening event. Attendees will not only benefit their own well-being, but have a chance to meet Sabres alumni, take a tour of the arena, and, again, more details on that at sabres.com.